Hello, everyone. I'm Dr. Renee Mehra. Joining me today, I have Dr. Kavitha Das. She is a dentist specializing in prosthodontics. She's a research scientist and she's a healthcare executive collaborating with many healthcare professionals, nonprofits, hospitals, trying to find innovative technologies and solutions to advance health and wellness, reducing the burden of disease, having better quality of life for because you're also a master's in public health and in social and behavioral sciences. So it's very important with early intervention and early detection to have more successful outcomes. So let's talk about first about, since your specialty is dentistry, let's talk about the importance of oral health, because there is an interconnectedness between oral health and our systemic health and our general well-being.
Thank you, Dr. Renee, for having me today. I'm excited to be part of this podcast and to reach to all, and have our work be known to people who are interested in this space. And I think my biggest problem has been that people work very much in their area of specialty. They don't necessarily work in an integrated, holistic way. And what I want to do is integrate oral health with systemic health. And why it is important is because everything starts in the mouth. It's the gateway to health. And people completely forget about it. The healthcare system, your insurance systems, even how our education is positioned is the mouth is a separate entity. And my goal has been to work very closely with doctors in cardiology, endocrinologists, with nurses, with community leaders, and hospitals and community health centers, and bring an integrated approach where we can address all these diseases that are both infectious and chronic at an early stage and reduce cost, reduce pain, reduce suffering, and also the overall burden of healthcare costs due to loss of productivity. So I think in the US, we had almost $50 billion loss in money in 2015 because of lost days, because people had to go see the dentist or they had to go to the emergency room. And these are very preventable diseases. So my focus has been how can we prevent diseases at an early stage before it even shows up, sometimes near blood work, and how to make it entertaining and fun. We don't want to be telling people do this because then people don't want to do it. But if they find this fun and healthy and happy, then that's a great space for us to start.
According to the Centers for Disease Control and Prevention, 1 out of 5 adults in the United States will have untreated, unattended cavity in their mouth. So that's where the problem starts. When there are risk factors where the problem starts to escalate, and we have oral systemic health issues. Which diseases will be affected?
What I have to start off, and which is very important to say, is a distinction between association and causation. Right? So you're a public health person, so you know it. But for everybody else, association is, this can lead to that. But with causation, what we're talking about is a strong connection between two factors. And if we do this, it'll definitely lead to that. So the reason why oral and systemic health connections are great is because we've been able to associate diseases between oral health and systemic health, like diabetes and cardiovascular disease, in pregnancy with preterm low birth babies, for example, but we have not been able to create an actual association. So there are several studies that have been done that prove this association. In 2018, there was a study that came out said there was absolutely no room for causation, right? So, but the other studies say there's an association. So there's more research that's needed to connect the two. So having said that and making it clear, because I don't want to scare people into thinking that, okay, my gums are bleeding, I'm going to have a heart, diabetes or have heart disease. So there's much more work and research that's needed going forward. But what that does mean is that, for example, if you have gum disease, you're at a higher risk for endocarditis, cardiovascular disease, and diabetes. And the pathways are inflammation, right? So inflammation creates a cascade of reaction in your body that can lead to other kinds of diseases in other parts of the body, which includes the heart, and then it can also lead to insulin resistance. Now, diabetes is actually more strongly linked because periodontitis, which is an advanced stage of gingivitis, which also can lead to bone loss, is related to diabetes. And periodontitis is called the sixth sign of diabetes. So there is a strong correlation in these areas, but not a causation.
And in 2021, World Health Organization underscored the importance of oral health and systemic health. So this is an important topic that we're talking about, the distinction between causation and interconnectedness. So are you planning to do some research into the causation factors as well?
So like right now we have association and then there's the whole causative. So we have causation is not yet established. The association has been established. So what we are trying to do is to see if we can work with some novel biomarkers that are out there in the market that focus on early detection of diabetes, even before it shows up in your HbA1c, for example, and see if that helps in, prevention. So this is at a very early stage. We're working with some very innovative biotech companies based in Silicon Valley, and we want to see how that progresses going forward. We are going to start with a pilot study, and if we get good results, we can expand that pilot study into something larger. I'm also very strongly interested in having an integrated electronic health system. So dental information is not always integrated in the electronic health system. Kaiser Permanente, for example, in some of their locations has an integrated medical dental system. So if the dentist opens the healthcare record, the electronic healthcare record, they can see that there is a definitive, what are their systemic diseases. A lot of times we have to ask them, but if we have an integrated system that's already there and vice versa on the other side, they can see that this patient has periodontitis, they had gum disease, and, they can say, okay, maybe, especially if you're, for example, if you're in a gynecologist's office or if you're dealing with a cardiologist, then it can sort of come up as a factor that you can evaluate. And like I said, there's no causation. So we have to just work on creating that and seeing if there is. For all 5 years from now, there may be research saying there's no actual causation. So right now, it makes sense to just be proactive, see your dentist at least once a year, floss, and then rinse your mouth, avoid sugary foods, and eat healthy nutrition, raw, fresh vegetables when possible. So I know you're very much into the holistic space.
Absolutely.
So
Absolutely.
This is an integrated approach to health and wellness.
Talking about integrated approach, we spend 1.1 trillion US dollars on food related diseases. So we're talking about obesity, we're talking about diabetes, but there's so many diseases that come in because they're food related, and over 38 million people in the United States have diabetes, and almost over 98 million people are pre-diabetic. So this is a very critical issue, and US spends over $412 billion on diabetes, whether it's medical costs, unrelated direct costs. So it's interesting that you are working in the research area to find out more about all these risk factors. Same thing goes with cardiovascular disease. All these kind of seem to have an interconnectedness between oral health as well as inflammation in the mouth that can cause inflammation in other areas and other parts of the body as well. So what is the key takeaway over here?
The key takeaway is don't ignore your mouth. Don't be afraid to go to a dentist. And there are lots of innovative technologies that are available, even in the dental chair, to sort of deal with anxiety, right? So a lot of people are nervous about going to a dentist. They're afraid to go to a dentist. So find providers who are addressing your fear, your anxiety. And there are those providers that are out there. And have a holistic, healthy approach. See your physician, see your dentist, eat healthy, and sleep well. So it is that holistic approach, and be open to the new innovations that are coming, especially like, for example, in some dental clinics, not often they have this virtual reality or they have this TV that sort of helps you relax. They have a setting where there's, your anxiety is reduced. So look for those areas if you have dealt with anxiety in a dental chair or seeing a provider who's a dentist, so that you can still go and have an integrated, holistic approach to health, but also at the same time get your teeth checked at least on a yearly basis, more often if you're prone to caries and gum disease.
Absolutely. And you said everything starts from the mouth. And if you look at from the holistic healthcare systems, we always look at the tongue of that person. There's so much you can see from that, what's happening in the body. So eat well, sleep well, be positive, stay healthy. Those are some important key takeaways in every of my shows, especially over here because we're talking on oral health and finding that interconnectedness between oral health and our general health and our overall well-being. Thank you so very much, Dr. Kavitha Das. Good luck with your research.
Thank you, Dr. Renee.
And I'm Dr. Renee Mehra. Stay healthy, stay positive.